Hello, folks. Hi. Hello, everyone. How you doing?
Oh, there's a voice of God. Hello.
Hey. Yeah. So come on in if you're coming. So this is the community data dive portion of Rethinking Community. Thanks everybody for coming out. My name is Kaylan Baxter, and I'm Director of Planning and Assessment in the Pro Humanitate Institute at Wake Forest. Elizabeth, you want to introduce yourself?
Hi, I'm Elizabeth Lees, and I'm the Director of Data and Research at Forsyth Futures.
So Data Dives is a monthly series that we do in PHI. I created it really because I felt like initially we have so much data on campus and we don't really have a chance for folks to engage and to make meaning and to really talk about what the different experiences are of different folks across different identity groups or different experiences on campus. So Data Dives initially started as a way for us to look at institutional surveys and different things on campus, but I was encouraged by my colleagues to think about how we can use community data, how we can use faculty's research, and so here we are, hoping that you all will learn some things. I'll explain the format a bit, but I'll let Elizabeth talk a little bit about the Forsyth County Poverty Study and what Forsyth Futures does.
Hi, as she said, I'm Elizabeth Lees. I'm the Director of Data and Research at Forsyth Futures, and we're a local nonprofit that serves other nonprofits and community organizations in Forsyth County by doing data and analysis to help inform their work. And the statistics we brought today are from a study that we just finished up on poverty and risk factors for poverty in Forsyth County. So you'll see them in a couple different places. We brought statistics on poverty in Forsyth County, and something important you should know when we talk about poverty is, for some of you who are working professionally with poverty and poverty statistics, you probably already know this, but a lot of people in our community don't. The federal poverty threshold is set by the Census Bureau, at least for the data we're using, and it's at about $24,000 for a family of 4 in 2014. So in order to be considered in poverty, a family would need to make less than that. Most people do believe that that's too low, and it also doesn't account for cost of living across the lifespan or in different places. So that's something to think about. To kind of accommodate for that, one of the measures we did, we looked at census data for Forsyth County and estimated how much money people would need to earn to support their families based on their family's makeup. So you'll see in the poverty section, there's a measure on income insufficiency, and that's that measure. It's about twice as high as the poverty rate for Forsyth County. And we also have a measure in employment that looks at whether or not people are earning enough money to support their families based on their wages and how many hours they're working. And I would be happy to answer any questions about that as we rotate around. We also have data on concentrated poverty. Part of the reason we brought data on concentrated poverty is that when we look at academic studies on poverty, we see that living in a neighborhood with a high poverty level, sometimes 20%, we used 40% because that was a more conservative threshold and kind of a more universal threshold, it increases the risk of everybody living in that neighborhood being in poverty in the future. A lot of people think that's because of public and private disinvestment in those neighborhoods. For example, it might be more expensive to get groceries, you may not have good schools, there may not be as many grocery stores. So that's the reason we brought that data for you. We also brought data for unemployment, and that is over there. And we brought data on education, and that is over there. One thing that will help you when you're looking at the data is you'll notice that sometimes the bars have little lines through them. And the reason they have lines through them is that when you're dealing with census data, the census will give you their best guess, but then there's kind of some wiggle room. They'll tell you like plus or minus. And when we're dealing especially with small populations, like the Hispanic and Latino populations, that plus or minus can actually be really, really big. It can be like 8 percentage points. So they're like, yeah, we think your poverty rate is 40% plus or minus like 8. So when we're making comparisons, we don't always know for sure whether those numbers are actually different. So that's when you see those lines. And sometimes those margins of error are so big that the data isn't useful for most circumstances. For example, we take data requests from local agencies. Someone was planning a program in a neighborhood and they needed to know how many children under the age of 5 live in their neighborhood. And the number the Census Bureau gave us was 250, but it could be as low as 50 or it could be 500. And that's not useful for everybody. So there are notes at the bottom of these slides that will say things like there's a high level of variance, and that just means come and check with us if you want to use this number for something, and we can let you know how much wiggle room there is. Those are kind of the main things that you'll need. We also talk about peer communities a little bit, and those are communities that are demographically really similar to Forsyth County, and those were selected just to give us some context for what's happening in other communities.
Great. So the way this will work is it'll be pretty informal. I'm going to ask you all to count off into groups of, well, 1 through 4. And I'll tell you, so this will be station 1. The next station will be station 2. And then the far station will be station 3. And then we have one more station in this back corner that'll be station 4. So just keep in mind what your number will be. We'll give you 4 minutes at each station. Sorry, it will not be enough time, but this study is online, so if you all want to revisit it, I encourage you to do so. And also just in the spirit of, pro humanitate, I encourage you to think about equity in the context of our communities. So, data can be kind of boring, but I like data, but, I encourage you to talk to the other folks in your group about what the implications are for what you're seeing. And we have flyers at each station, so we'll come back for discussion, but I want you to think about what your initial reactions are, but also what you can do where you are to address some of the inequities that you'll see. Is that clear to everybody? Okay, so we'll start with you, Sylvia.
1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3.
Okay, folks, thanks for this lively dive into the data. So now we're going to do a little bit of discussion. Interested in what you all found. Alanna is going to hand you the mic, so please wait until she gets to you to say what you have to say. Yeah, so let's just start with general reactions. How was that exercise? What did you learn? How was it? Okay.
Thank you for this exercise. And you know, when you see data, especially when you see quantitative data, it always makes you wonder about the why, the questions behind this. So is there a qualitative component to this project as well?
Elizabeth would be the one to answer that.
So we did, the qualitative component that we did in this study was actually mostly focused on identifying risk factors. That's a possibility for a future study would be to go through and kind of ask questions about the why with the statistics. And that's a great thing about research is there's always this could be the next study. But we did go through and talk to community members, but the focus of those conversations were on what we should be researching and what topics we should be looking at.
Has there been any comparison data, like with the housing, when we were looking at it, from, I think it was 2011 to 15, maybe from like the 60s, the 70s, the 80s, to see if those numbers have been consistent, knowing that, yeah, there's undercover kind of housing discrimination, but if it is now, because you have data, obvious that, yeah, discrimination in housing and segregation is still going on, because it seems to be the concentrated housing numbers and those in poverty seem to be, I would like to see if they've changed any since, when was it, 65, 64, when they did the, after everybody got assassinated and then they signed into, after everybody got assassinated. I can gladly say I was born after everybody got assassinated. That they put that into effect, that now we want to see whether or not actually housing has changed.
That would be interesting to look at. That would require going back into the historical data from the census, and we were doing it kind of, they've recently changed the way they do the long form of the census, so we've been doing it from that point on, but that would be definitely worth looking at in another study.
So I just wanted to draw attention, we were just coming from the graphs in the back about concentrated poverty. And I think for me the most interesting in that particular, in those particular data are the distinction between Guilford, which is, what, 30 minutes to the east of us, I mean, or immediately to the east of us, and Forsyth, and the idea that the percentage living in concentrated poverty goes up dramatically in Forsyth, while ticking down just a bit, not a lot, but ticking down just a bit in the exact same time period in Guilford. And I'm just wondering, I mean, obviously that's just a data, those are just data points, but I'm wondering if if you've been doing any hypothesizing about that, or if you have any data that you've done, if you have any models that we're just not seeing here that might suggest what's going on there about the fact that our neighbors just to the east have seen a decline in concentrated poverty at the same time that we've seen an increase in it.
So part of the, I think one thing we didn't include in these visualizations that is interesting to note is part of the reason we have had such a large increase in concentrated poverty is because census tracts that were not previously above 40% transitioned into having a 40% poverty rate during that time period or between those two frames of time. So that's part of it. There's a lot of wiggle room when you're dealing with the census tracts. So I think it could be a matter of just how things fell in Guilford and how things fell in Forsyth County. But I think it would be a great thing to follow up with people in Guilford. That wasn't something we really had the resources to do with this study, to be able to look at other communities and really ask them. We've had, I think, a couple community partners have actually, if you notice, Roanoke, especially with concentrated poverty, did something very different than the rest of the community. And we had a community partner who emailed and like kind of a sister organization in Roanoke and asked, why do your statistics look different? And they gave them an answer and they sent it back. So that's definitely a possibility for people who are engaging in this work and really interested, is talking to Greensboro and being like, you're right down the street from us. What do you see happening in your community, and do you have any idea why it might be different from what's happening in our community?
I just want to be sure that I understand. So you suspect that it may not be a genuine substantive result. You suspect it might be simply a measurement, an artifact of measurement?
I think it's more likely than not that it's genuine, but it's one of those things when you're doing research, you can never be completely like 100% sure. But I think it would be something that before definitely modeling exactly what everything that's happening in Guilford it would be worth ground truthing that in Guilford and seeing if they're seeing on the ground and their residents are seeing the same things we're seeing.
I was wondering, so I live in Guilford, and Wake, I mean, I haven't not been to Winston-Salem very often, but this seems very new to me. And I can't think of any space in Greensboro. So I guess my question is where is gentrification happening and to what extent? Yes. Because when I think about Greensboro, I don't see any areas that, concentrated areas that look like this. And I think when that happens, it displaces people into concentrated areas. So that was one of the thoughts I had about the potential of it raising.
Our group also hypothesized that Business 40 and its shifting might have something to do with that as well.
A couple of things going back to the Station 3, I guess, is, you know, you had the peer, I don't know who I'm talking to, hey, Roanoke was another peer community, and that, I think, out of all of them, was the only one that actually showed a shift down. So, I mean, I guess, what are your thoughts about, I mean, besides, you know, potentially the measurement and, you know, the things changing, that shift down seems pretty huge just to be an artifact of measurement. So did any thoughts about why the big shift there, and maybe what we can, maybe looking at Roanoke and see if there are things that happened there or policies or whatever that were maybe instituted to address the poverty issue? Because that to me was kind of a glaring, like, whoa. I mean, yeah, it was one of those slashed, you know, bars, but that still was like, whoa, that's a huge shift down.
The other thing I was wondering is, in these concentrated areas of poverty where we saw the huge shift, I was wondering how much of that was the workers that were attracted here by the corporations to do the very low wage work, the large Hispanic population that increased mainly in black areas. And I was just wondering if that had anything to do with those numbers going way, way up. And I don't know if they had the same thing in Greensboro. So I don't know if that would be a factor as well. But I do know that areas that were a totally black area at one point, the Walton area, became totally Hispanic area. And I wondered if where did those blacks go that were living there before? And where did that shift? How did those shifts take place?
So that's an area in which, unfortunately, the Census Bureau, as far as just data that is available without actually individually surveying residents, only asks, I think, whether or not how long you've lived at your address and whether you've lived in the county. We don't have great publicly available data on people who are shifting from one neighborhood to another. So we know that people have moved, but we don't necessarily know from what neighborhood.
So these are all really great questions and comments. I hate to shift us in a direction, but so what? What is the big picture here? Why are we here doing this? Why was this a part of Rethinking Community? And, you know, you all brought up a lot of great things, a lot of disparities that you're seeing. So what can we do? What should we be doing? What's the big picture here? What are you taking with you and thinking about, hopefully?
I was reminded that for example, an unemployment rate for an area doesn't always account for differences by gender and race and ethnicity and things like that.
Right. Hey.
Because I had to put that on the board at some point, obviously.
It's all good. I think for me, one of the most surprising things was actually on this last section here, was looking at the education attainment and comparing that with poverty rates. And it was very interesting to see that the pattern that you would expect to see, right? That if you have a high percentage of a group that's lower educated, that they would be the poverty bar for that group would be the highest percentage, and that absolutely was not the case. It was actually swapped, and that to me is very concerning, because as an educator, we tell our students, education is this ticket, out of poverty, and looking at data like that, you can't make that blanket statement, because it's, at least in the way that it's represented here, it's not really supported. So again, that whole intersectionality of looking at these topics is very important.
I also had another thought looking at it. My wife has done a little bit of work with some of the Hispanic community, that especially it's connected with the school where my youngest goes. And we have a very hard time getting the parents of the children to be involved in the school. They're suspicious of all sorts of reasons, of things, for obvious reasons. And that's true too. But even things like they don't want to give you their address, they don't want to give you their phone number, they don't want to give you their email address. And so I think, in looking at some of these statistics, it makes me realize that part of building a community is not just having there be opportunities sort of in the abstract out there, but figuring out a way to make them real to people by building a kind of trust. This is something that we can do something good together. We're not going to sell your data somewhere or inform somebody on you. And that's a real challenge. And it's not just saying, well, there is something out there and why don't you go do it? Well, sometimes you have to go and be part of a community and generate a kind of trust. Yeah, go ahead. Yeah.
I just, all the time when I see data, it's just constantly just seeing black and brown in terms of the disparities, and just thinking about structural racism and how we can look at policies, evaluating policies from a perspective of its racial impact. If that's a way to aggregate or look at the data in that, with that lens, just looking at, certain industries moving out and it had a racial impact. What are the impacts of that? And just really kind of calling out the racism, because it's really disheartening to see time and time again that it's African American and Latino communities that are continuously reflected in the data to have, the low unemployment rates, the disparities. And so I think it's just really calling out the structural racism and really looking at ways we can evaluate policies and changes in our communities from a racial impact lens, if that's possible.
Although let me also jump on that, because in North Carolina, part of what might, because yes, and on the question of the importance of disaggregation, the other thing though that can happen in doing that is we also paper over the poverty of white folks in ways that can keep us from building coalitions that are both necessary for alleviation of poverty of white folks, and that can fail to create both the necessary political and problem-solving coalitions, right, and solidarities. And so, we look at those disparities, and the disparities are so real, but they can also make you go, oh, well then all the white folks are fine. And I will say, it's interesting in the context of Wake Forest, and I just want to just say this real quick. It's one of the things that's been interesting for me in the classroom is that Wake has actually done a good job in our admissions with figuring out how to find extremely talented white students of economic need. Our admissions officers are really good at it. I don't know what it is that Martha Allman has done in terms of finding admissions officers who are really good at reading applications in a way that find great first-gen students and white students who are students from economically impoverished backgrounds. So often, I'm looking at students in my classroom, I don't know who they are, but I get to know them later, and they're white students who come from nothing economically, who are really great students. We are doing less well in our admissions capacities around Black and brown students, right? We are not doing as well in both finding them, reading their applications, admitting them, and transferring them into becoming Wake Forest, both students and graduates. But it's just worth noting that, like, we need to be able to both see the disparities, call out the racism, and also not miss that, like, there's a whole bunch of poor white folks with a hell of a lot in common with the folks on the Black and brown scales too.
And adding to that, because, well, I think about that also has to do with, you know, media depiction, right? So we have a lot of, you know, we have stereotypes in our country about who's poor, right? It's just Black and brown people. And the opioid crisis you brought up, all of a sudden is, oh, this is a crisis because it's affecting more white people. Or now with the, you know, the discussions and debates about, you know, the Affordable Care Act and repeal replace, it was like, well, guess what, low-income white people who voted for Trump, this actually is gonna affect you a lot worse than, you know, and I think part of that is because there is this stereotype and this vision and this image that's put out there, this archetype of who's poor, and very often who's poor is not someone who's white. And that's not the reality. And it's and what happens is, and this is, you know, part of people ask, well, why is it that you have these, you know, white, low-income, poor people who are voting against their interests? It's because, you know, they know they're poor, but in the national conversation, they're being told, oh, it's not you who's the poor group, it's these Black and brown people. And if you have ideas or you have beliefs about Black and brown people, then yeah, I will vote against this amazing program that actually will absolutely help me and the people around me who look like me, but because I feel like I'm voting for it to help another group who I don't necessarily like, I'm voting against my own interests, and they don't understand that. So I think part of it is what's being put and what narrative is being pushed out and has been pushed out for years and years and years in this country. And I'm seeing glimmers of it changing because now we are seeing those headlines. Well, oh, by the way, Rust Belt people, this tax plan is actually going to affect you worse. But that conversation is now happening at a national level because all of a sudden it's because it's really going to be affecting white people. And I think that's a problem. Yeah.
Okay. All right, I have a question. I'm with, I work with, okay, I have a question because I work for the Forsyth County Budget Office. And so my question is how...
This question should probably not be for me. I'm just gonna not
That's
for
why
me.
I didn't put it on the sticker. That's like we trying to see who real, what they coming with. That's why I didn't put it on sticker. So, but I want to know, how is this information being communicated to the boards, the county commissioners who ain't never been hungry, or when they were hungry, bread was a nickel. So it's a little, you know.
That's for Elizabeth, yeah. That. Mm-hmm.
But you know what I'm saying? How are you telling Dr. Martin that these people that are in poverty and these people that are experiencing the housing are not just the folk down here on Cleveland Avenue, they're the folk that are out in the rural thing that you're arguing about a noise ordinance because of a rooster and folk not even eating every day. So.
Thank you for standing up for roosters. No, for real.
You're very welcome.
No, for real. They tried to make me kill my rooster.
Oh, no, don't be killed, no. No, everybody like chicken. Y'all got Chick-fil-A down here. What are y'all talking about? We don't even have Chick-fil-A in Detroit. We just got one. But I want to know, how is this, because a lot of times for some reason there is a, I don't want to say intellectual disconnect, maybe it's a cultural disconnect, that I look at this chart and I see, dang, it's a whole bunch of poor white folk and women and people with a whole bunch of kids. Maybe we should do something to help the people in poverty who like have ovaries and can't seem to get out to do 2 full-time jobs. And the people sitting on the county board commission say, no, we need to make people have as many babies as they want. Okay, well, sir, who gonna take care of all these kids? What are you doing? We don't need contraceptives. We don't need to be telling people about the clap. Okay, no.
how are y'all communicating? No, because for real, the commission tends to be very old, very old. No, for real, very old, very male, and they don't. They tend to be very old, very male, and they want to be conservative and don't want advertising to go out to say, come down to public health and get checked for venereal disease. They just want to kind of assume that everybody being Jesus saved and not hooking up. So that's what I'm saying.
I appreciate that
How are you
comment. I think
That's
Elizabeth.
my whole question. How is y'all communicating?
So, if Elizabeth wants to say a couple of words, then if you want to, okay, because I appreciate all this, so we got to wrap up, but like two more comments.
So really
Yeah.
quickly.
Yes.
Really quickly, just to wrap this up. When I'm looking at everything we're looking at data, and so here we're talking about what communities need. And because of who I work for, Neighbors for Better Neighborhoods, we look at communities for the assets that they have. So it's asset-based community development. And that's how you gain trust and build trust in a relationship. When I walked up to someone who's in poverty and asked them what their gift, skill, and talent is, I cause them to think about something that perhaps they maybe haven't thought about in a long time, because I'm not asking them about the deficiencies. And so I believe that the way we move forward is by choosing to look at the value of each person, taking that value and building communities back. Exactly. So many times we pick out who's poor and who may not have a certain education, but what about what they do have? If we look at that, then we can move forward and we'll begin to see the change that we want to see.
Thank you. Yes. So I apologize. I feel like the conversation is just getting rich, but we are at time. Thank you, everybody. Elizabeth, thank you so much. Elizabeth, thank you for co-facilitating with me. And Alondra, thanks for helping out. Thanks, everybody.
Wow, I always seem to come into the conversation at the oddest times. I was like, wow, that's a spirited discussion. The clap. Whoa. Oh, yeah. It's not on the board, Kaylan. Well, everyone, yes, talk about the clap. Ooh, simmer. Okay. My name is Alanna James. I'm Associate Director of Community Engagement here at Wake Downtown and for the Medical Center. And I wanted to welcome you to our house, your house. And it has been said, our esteemed Dean Michelle Gillespie earlier said, you know, this all used to be tobacco factories and plants in support of this industry that helped build this community. And I thought the same thing, you know, what a way to rethink community. It's not lost on me that it's the tobacco industry. We now have a Center for Medical Education here, but that is how we innovate. You know, these buildings could have stood as they have stood for the past few decades, but somebody had a vision and someone saw that this was an asset right here in this community and that it should be repurposed. And now, being in this unique position, I also went to Wake Forest. It's yet another one of those things where I'm like, really? Y'all couldn't have done this when I was in school, huh? Couldn't have done it. But it's been very exciting for me because I stuck around. I'm not from Winston-Salem originally. I'm from Ohio. And I stayed here, and it's been such a blessing and such a joy to see Wake Forest and other community partners leading the way in this type of innovation. It's a beautiful space, and one of my charges is how do we make this a true community asset, right? You know, this is new space for Wake Forest. We have this beautiful, idyllic, gated campus, right? And now that we're here, how do we make sure that we are a welcoming and open neighbor? We're a resident, right? We have literally Plant 64, which is a residence. We have Goler Manor. We have all these different businesses that have existed here before we got here, right? So what does that mean? And I think that Arletha, just a minute ago, was talking about asset-based community development. We have to ask, right? If you don't know, or if you have ideas, you still have to ask. And so one of my questions for you all today is how do we do that? How do we open our doors? How can we use this space in ways that we haven't before? How can we do things that we've never done before? Even though we might experience discomfort, it's no excuse for us not to do it, right? So we have a number of individuals here who are going to share with us their visions, their expertise, their thoughts. They're going to wax poetic with us for a few minutes. And we decided on the Picha Kucha format, which is a 20 by 20. So 20 slides with images that last for 20 seconds, and it's automatic. And I've really enjoyed watching this process because I can go on forever. Like, if I had slides going right now, I'd be like, oh, shoot. But it's a low barrier to entry, right? So a lot of times people don't have access to the tables that we sit and have these discussions. And so we wanted to make sure that anybody who had an idea, had a vision, had an opinion was able to come and do that. So on the flip side, some of these folks have been doing this work for decades, and they could talk about it forever. So it's been really fun for me to watch them try to figure out how to get this vision into 6.5 minutes. So it's enjoyable for me. It's a little bit of a panic for them, but it's always good to put yourself outside of your comfort zone. So everybody will be talking for about 6.5 minutes. We have 3 classrooms that are set up. Outside of them, we've got bulletin boards with each of the presenters' names and their topics. We encourage you to float amongst the classrooms. You're not going to be interrupting. You can pop in and out of classrooms. There will be a couple minutes afterwards for some discussion. But the point of this is to feel like, oh, if we just had, I have a question, can I talk to you? Good, because we want that to continue into the afternoon and obviously into additional partnerships after this conference is over. So, housekeeping, we're gonna head straight through the lobby. There are some snacks, there's coffee, there are beverages, and you can feel free to take those into the classrooms. We'll be in 1615, 1616, and 1617. You'll also pass the hallway where the bathrooms are. If you have any questions, just find anybody who is wearing a name tag or by the information desk. So looking forward to the conversation.